An orthopedic surgeon is a physician that's been trained, has been a medical doctor already, and has 5 years of training in residency. And that's extra training that we have to learn about the musculoskeletal system, including dealing with problems with arthritis, fractures, tendon and ligament injuries, sports injuries, not just surgery, but also dealing with non-operative treatment plans to get the patient back into a better function. The majority of the patients that we see here in the office are usually treated with injections, physical therapy, and some medication to control the pain and get them back to functioning again. We're not just specializing in one particular age group. We take care of the pediatric population, the children that have injuries or have problems with joint aches and pains, all the way to adolescent time frame and adulthood, and all the way to the master athlete or senior and above and geriatric population. As a gentleman that is in his 90s now, and was actually a fighter pilot, was in World War II, Korea and Vietnam, served in all those three theaters, and was very active even into his late 90s. I'm talking about not your typical 90-year-old person. This gentleman was going through safaris in Africa, all over the world, and he essentially had a lot of trouble with his knees after he had an injury while he was in Africa, and he fell off a camel. And essentially we got him rehabilitated, and eventually he wound up needing a knee replacement. And at this point in time, he's my oldest patient that I've done a knee replacement on. And we have replaced both of his knees, one at 91 and one at 92 years old. And at this point in time, actually, he's back in Africa, riding the camels and doing the safaris that he enjoys doing. He travels all over the world. It's very rewarding to really see what the training that we had, all the hard work that we put in to get to where we are, has actually paid off. And the best payoff is when you see this person that was hurting and not able to do the things that he or she liked to do, and now is able to do that. The Riverside care difference, in my opinion, I believe is the ability to have really subspecialists in the different areas that we could draw from to take care of the complex problems that we encounter sometimes in medicine. And in orthopedics, we have folks that have fellowship training in sports medicine, trauma surgery, as well as other subspecialties such as hand surgery. So whenever we have a patient that has a particular condition that we may not be able to deal with as a general orthopedics, we could draw from those folks and be able to help that patient instead of sending them far away to another system. Life outside work revolves around my family. I've been married since 1999 to my wife, Tenora. Have two beautiful children as well, Katiana and Lucas. And my father, Jose, lives with us as well. He's now 91 years old. And the main reason we moved to this area in the Middle Peninsula was that we all enjoy the outdoors. I enjoy fishing and hunting, and pretty much all the activities on the river that we're blessed to have here in this area. The one thing that you need to know is that we are in a very small community, and because of that, we tend to care for each other, not just our staff, but also our patients, just like if they're our family. Because a lot of times, the patients that we're taking care of are our family, or our neighbors, or friends from church, or friends from the community. And it's important to know that, for you to know that you have access to great care in this office. We have a great team, not only just for the front staff, but the medical assistants and the nurses, but also the physician assistants and the healthcare providers. We all get along well for one goal only, and that's to take care of you. I'm Dr. Perez, orthopedic surgeon and sports medicine specialist with Riverside.